Proton pump inhibitors are one of the most widely used drugs in the world. They are a group of drugs that's main action is a long-lasting reduction of gastric acid production, used for peptic ulcers, are breakages in the mucosal lining of the stomach or duodenum, which can be caused by Helicobacter pylori, acid overuse, smoking, stress, hyperacidity disorders. First cause to notice Helicobacter pylori. A spiral-shaped bacteria that affects approximately 30% of the world's population. Its presence causes irritation and inflammation to the stomach's mucosal lining, allowing acid to create an ulcer. Gastroesophageal reflux disease, otherwise known as GERD, occurs when stomach acid leaks into the esophagus via weakened lower esophageal sphincter, creating a burning pain and causing discomfort. Common drugs used include omeprazole, esomeprazole, and rabeprazole. Their mechanism of action works by irreversibly blocking the chemical process known as the hydrogen potassium adenosine triphosphatase enzyme system, better known as the proton pump. This occurs within the parietal cells of the stomach's lining. That's here. Blocking this decreases the amount of hydrogen ions released into the stomach acid, decreasing the overall stomach acidity. This decreases the pain and discomfort of reflux, and allows peptic ulcers a chance to heal. So, the positive and negative effects of PPIs include its fast-acting, which can avoid potentially life-threatening conditions like acute bleeding and perforation. But its negative effects include drug interactions, spontaneous fractures, hypermagnesemia, Clostridium difficile infection, etc. One notable drug interaction occurs between omeprazole and clopidogrel. Clopidogrel inhibits platelet aggregation and is used for those at higher risk of heart attack or stroke. However, the ASO enzyme that metabolizes this drug, CYP2C19, is inhibited by certain PPIs, in particular, omeprazole. This renders clopidogrel ineffective and increases the chance of heart attack and stroke. Omeprazole also affects the enzyme sulfochrome P450, which increases blood concentration, levels of digoxin, dillanthine, and diazepam, which can be fatal. Also, reducing the stomach's acidity affects the absorption and bioavailability of antibiotics and antifungals. Spontaneous fractures have been known to occur within the hips, wrists, and spine. It may be caused by decreased calcium absorption within the stomach, or by the inhibition of other proton pumps within the bones. Hypermagnesemia is also associated with the long-term use of PPIs. Can also be caused by the reduced magnesium absorption within the small intestine due to the neutralized stomach acid, also reducing magnesium's transport enzyme TRMP6/7's affinity. Hypermagnesemia may cause ataxia, cramps, GIT disturbances, seizures, and cardiac arrhythmias. Due to these side effects, it is recommended that long-term PPI users have magnesium levels checked regularly. Clostridium difficile infections occur due to the hospitable environment formed within the gut. Clostridium difficile spores convert from an inactive state into its vegetative, infective form, surviving and driving. Recommendations: if you are considering taking a PPI, take into account the severity of your illness. Ask yourself, how long will you be taking this drug for, and do you have any other conditions that may affect this treatment? Are you taking any other medications that may have an interaction? If you are already taking a proton pump inhibitor, are you being monitored by frequent blood tests? Is your treatment still justified? Be wary of over-the-counter drugs, as they may have side effects, and use only under the guidance of a medical professional. Thank you for your consideration.